Johns Hopkins Medicine uses social media as a key part of its mission to promote better health and patient awareness. Their goal is to make healthcare knowledge more accessible and to connect with people in ways that encourage prevention, education, and trust in science. Through consistent, compassionate communication, Johns Hopkins turns social media into a tool for healthier communities. In today's digital world, social media has transformed how healthcare organizations communicate with patients, share knowledge, and promote healthy behaviors. We are focusing on Johns Hopkins Medicine, one of the world's leading academic healthcare systems. They have developed a strong social media presence to extend their mission of improving health through education, research, and patient care. Headquartered in Baltimore, Maryland, Johns Hopkins Medicine serves both local and global populations through its hospitals, clinics, and medical school. Its mission emphasizes innovation, compassion, and collaboration. The organization provides advanced medical care, conducts groundbreaking research, and promotes preventive health. Its audience spans multiple demographics of patients, caregivers, students, and healthcare professionals, reflecting the organization's global reach and credibility. What makes Johns Hopkins Medicine digital presence so effective is its ability to communicate complex health topics in simple, relatable, and visually engaging ways. Before diving into social media, it's worth noting how Johns Hopkins Medicine uses technology to improve patient experience through its Find Your Way mobile app. The free tool helps visitors navigate the hospital easily, guiding them from parking lot to clinics, labs, or doctor's offices, and even showing restrooms or cafeterias along the way. Linked with MyChart, it lets users see appointments and directions all in one place. It is a simple innovation that saves time, reduces stress, and makes healthcare visits smoother for everyone. Talk about how Johns Hopkins Medicine connects with people on a much larger scale through social media. We'll start with YouTube, which is kind of that like digital classroom, sharing expert interviews, wellness talks, and touching patient stories that show the human side of medicine. With millions of views and playlists on topics like heart health, cancer care, and mental wellness, their videos make complex information easy to understand. What stands out is their sincerity. Doctors explain in simple, relatable ways, and patients share real experiences that inspire trust and connection. Next up is Facebook, Johns Hopkins Medicine Community Hub with over 500,000 followers. They post daily, sharing health tips, event updates, and awareness campaigns like breast cancer and mental health week that spark real engagement. The posts are friendly and down to earth, filled with warmth and compassion, making it feel more like advice from a caring friend than a medical page. Twitter, now called X, is where Johns Hopkins Medicine shares quick, reliable updates. Posts are short and timely, covering research news, health alerts, and safety tips. During COVID-19, they helped fight misinformation with clear, evidence-based facts using conscious language and infographics. They reach media, researchers, and public, making X the organization's real-time pulse for trusted health information. LinkedIn is Johns Hopkins Medicine's professional voice, sharing leadership updates, career opportunities, and medical achievements, connecting healthcare workers, researchers, and students while reinforcing its reputation as a global leader in healthcare excellence. Finally, Instagram focuses on visual storytelling, sharing bright, easy-to-follow content, perfect for younger audiences. Posts include infographics on nutrition and stress, along with short doctor reels uplifting patient stories with strong engagement through likes, comments, and shares. It beautifully humanizes healthcare and extends Johns Hopkins' reach beyond hospital walls. Beyond their strong presence online, Johns Hopkins Medicine continues to make healthcare personal through a program called Johns Hopkins Care at Home. This service brings high quality medical care directly to patients where they feel most comfortable, which is in their own homes. It is designed for people recovering from surgery, managing chronic illnesses, or transitioning out of the hospital. A dedicated team of nurses, therapists, pharmacists, and aides work together to provide everything from wound care and IV therapy to rehabilitation and medication support. The idea is simple but powerful to keep patients safe, supported, and healing without unnecessary hospital stays. Families love the program because it lets them be involved in care while patients get to recover surrounded by comfort and familiarity. In many ways, it's an extension of Johns Hopkins' mission, bringing expert, compassionate care closer to home and making healthcare more human. Johns Hopkins Compassion shines through its Children's Center, one of the nation's top pediatric hospitals. It is a place where expert medical care meets warmth and understanding. The hospital is designed just for kids, filled with color, art, and cheerful spaces that help replace fear with comfort. The care teams like doctors, nurses, and therapists work closely together to provide treatment that heals both body and mind. They focus on supporting families too, guiding them with empathy through every stage of care. Beyond medicine, programs like art therapy, music sessions, and hospital schooling help children continue learning, laughing, and staying strong even during long treatments. Parents often say what makes Johns Hopkins truly special isn't just the advanced care, it's the genuine kindness and encouragement that make every child feel brave and family feel supported. Behind the scenes, Johns Hopkins runs one of the most advanced hospital coordination systems in the world, the Judy Ritz Capacity Command Center. Picture a state-of-the-art control room glowing with massive digital screens and real-time dashboards. It looks like a mission control center, but instead of monitoring airplanes, it tracks patients, beds, and medical resources across the entire hospital network. Every piece of data, from admissions and transfers to emergency room flow, is visible to a team of experts who make critical decisions in real time. If one unit becomes full, the system automatically alerts the team so they can reassign patients, open new rooms, or adjust staffing levels. This keeps the entire hospital running smoothly no matter how busy it gets. The command center brings together nurses, data analysts, administrators, and transport coordinators, all sitting side by side, collaborating every second of the day. It's where technology meets teamwork. During high pressure situations like the COVID-19 surges, the command center became the hospital's heartbeat. It predicted patient volumes, balanced ICU capacity, and coordinated transfers across different facilities to ensure that no one went without care. The results have been remarkable: faster admissions, shorter wait times, and better use of every available bed. Johns Hopkins has also seen improvements in surgery scheduling, patient transport, and even emergency response coordination. Beyond efficiency, what truly stands out is how the system embodies Johns Hopkins' commitment to patient safety and compassion. It shows what innovation doesn't just mean new machines or apps, it's about using data and collaboration to deliver care that's faster, smarter, and deeply human. The Judy Ritz Capacity Command Center proves that behind every smooth hospital experience is a team working tirelessly, guided by technology, driven by purpose, and dedicated to every patient who walks through the doors. Strategies for improvement is there is a room for growth. They could host live Q&A sessions on YouTube or Instagram, offer short polls on Twitter, and encourage users to generate stories on Facebook. More interactive engagement would further build a sense of community and allow audiences to feel seen and heard.